Hello and welcome to Loke Talks. This is Dr. Lokesh Bhatia. Dear friends, today I'll be talking to you about a very important and very commonly being presented in our orthopedic clinics, an entity which is producing pain on the lateral aspect of this wrist. Most of the times patients are complaining of pain on this aspect of the wrist. Lateral aspect. We call it lateral aspect or the outer aspect of the wrist. When we keep the hand like this is outer aspect, this is inner aspect, right? Alright, so what is it called and what is the treatment, what entity I'm discussing? I'll let you know in a short while. Stay tuned to Loke Talks and make sure that you watch it till last, and I hope you like the content of this video. Sounds very helpful to you. Do share it with your friends. Don't forget to subscribe to this channel.
Namaskar. Welcome to Loke Talks. Thank you very much for subscribing to this channel for professional medical guidance, spirituality and meditation and life coaching. Here is my WhatsApp number. Do connect me in person if you have any question. Thank you.
Entity I'm talking about is called DeQuervain's Tenosynovitis. DeQuervain's Tenosynovitis is also known as DeQuervain's syndrome or the tenosynovitis of the dorsal compartment. Is a painful condition that affects the tendons and the thumb side of the wrist. It occurs when the tendons become inflamed and irritated, causing pain and difficulty with gripping, grasping any object. The tendons involved in DeQuervain's tenosynovitis are extensor pollicis brevis and abductor pollicis longus tendons, okay, which helps to move the thumb and the hand to lift any object. These tendons run through a narrow tunnel which is called the first dorsal compartment, which is located on the thumb side of the wrist, right? So the DeQuervain's tenosynovitis is often caused by the overuse or a repetitive strain of thumb. Such activities are involved in gripping, grasping, pinching, any fine work, painting. All these work becomes very, very difficult. And many ladies who have delivered babies, during their nursing and all, say they develop this problem very often. So symptoms of DeQuervain's tenosynovitis include the pain and tenderness on the thumb side of the wrist, swelling and stiffness of the thumb, difficulty in grasping and gripping objects. Treatment options. Well, before discussing treatment options, I would like to discuss what test. There is a provocative test, we call it Finkelstein's test. This, the opponent's action, or when you ask the patient to put it in your feast and make a feast of it and turn it towards the inner side, towards the inner side of it. It is very painful for any patient, and this is what clinches the diagnosis, and this is called DeQuervain's tenosynovitis, right? So the diagnosis is purely on the clinical basis, right? But yes, we definitely ask for X-rays. We may even ask for MRIs in difficult or resistant situations. Let's discuss now the treatment part of it. So, DeQuervain's tenosynovitis is often caused by overuse or repetitive strain of the thumb or the wrist, such as during the activities that involves gripping, twisting, pinching. It can also be caused by the direct injury to the tendons or by conditions that increases the pressure in the first dorsal compartment, such as pregnancy or rheumatoid arthritis. Symptoms of DeQuervain's tenosynovitis include the pain and tenderness of the thumb side of the wrist and the swelling and stiffness around the base of the thumb, this area, right? So the treatment options may include the rest, ice fomentation, anti-inflammatory medications, and physical therapy or physiotherapy. In some cases, very resistant to the conservative management, it may need a surgical release of the dorsal compartment of the tendons. In addition to the symptoms mentioned, either the other signs of DeQuervain's tenosynovitis is a creaking or a snapping sensation when moving the thumb, or difficulty in wrist movements, or many times in texting also on the mobile, also it can increase the pain. Diagnosis of DeQuervain's tenosynovitis is usually based on the clinical examination, physical examination and the medical history is very, very important for the clinching the diagnosis, right? There can be contributing conditions like pregnancy, lactation, or there can be because of dermatitis, arthritis, or such connective tissue disorders. Treatment, very important part is splinting. All right, thumb wrist splint along with splinting the wrist. All right, and resting position, little bit and cock up splint. It definitely helps for a period of 3 to 4 weeks time, and this is how a week or 10 days of anti-inflammatory medications definitely helps the patients in acute phase. 3 to 5 days time of ice fomentation. How to do ice pack fomentation I have already covered up in my previous videos. I can leave the link here. So surgery may also be considered in a very resistant or persistent cases. If it is more than 6 months, we may have to consider it for surgery. In surgery, we just release the tendon sheath, and it is very important to seek a medical attention if you are experiencing the symptoms of DeQuervain's tenosynovitis, as early diagnosis and treatment can help to prevent further complications and improve the chances of a full recovery. I hope this information has definitely helped you to improve your awareness and to upgrade and give you a better understanding about this particular entity. 90 to 95% of patients will improve in conservative management. It is not an entity which very frequently requires surgery, but yes, very rarely, and just 5 to 10% of patients may require surgery. Alright, thank you very much. Make sure that if you have liked it, don't be hesitant to hit on the like button.